Imagine a word that is silent, one where you cannot hear anything around you. Think about how you would communicate with others and carry out your daily life. For 6 million people in England, their eyes are as important as their ears when it comes to hearing what someone else has to say. Lip reading enables individuals to distinguish words and phrases, as well as some might struggle to hear, or perhaps cannot hear at all. The movement of one's mouth allows an individual to follow a conversation without being able to hear what is being said. Imagine yourself back in the silent world, one you've been in for a while. You found new ways such as lip reading to aid your understanding of others. Suddenly, that method is taken away from you. The 2020 coronavirus pandemic has impacted billions of people across the globe and changed the way that society works. Face masks enforced by global organisations have been a crucial way to help stop the transmission of the airborne virus, but this has led to communication difficulties in those in the deaf and hard of hearing community. Non-transparent face masks prevent individuals from being able to lip read, so the 6 million individuals that require lip reading suddenly struggle to carry out some of the basic tasks in life, such as talking to friends, going to shops, or even talking with a healthcare provider. One study done in April 2020 showed that 79% of people who have hearing difficulties struggle with society wearing non-transparent face masks, with 69% saying that they constantly felt worried that they were regularly mishearing others. Such anxiety has led to almost half of those with hearing difficulties feeling isolated, and a third feeling as if they had lost their independence. Even before the pandemic, the employment rate of those that were deaf and hard of hearing was significantly lower than those without a disability. Many people feel that their employment options are limited with their hearing disability, and then with the pandemic, many more are now struggling with their clients and colleagues wearing non-transparent face masks, making work stressful and sometimes extremely difficult. Hard of hearing is much more common than you may realise, with 1 in 6 adults in the UK affected by some form of hearing disability. When I first appeared on your screen, did you realise that I was hard of hearing myself? Perhaps not, but that highlights the difficulty in tackling the situation. You may have seen transparent face masks being sold, ones that allow those that struggle to hear to be able to lip read. But the problem is, it is not those with the hearing difficulties that need to wear these, but everyone else around them. Deaf people themselves cannot go providing transparent face masks for every individual they come into contact with. Whilst the UK government allowed friends and family members of those with hearing difficulties to not wear a face mask when travelling with them, there are still many individuals that someone who is hard of hearing interacts with on a daily basis that might not have a transparent face mask. Given hearing difficulties is not a visible condition, it means that people might not realise that they are talking to someone that might struggle to understand what they are saying. Of course, someone can just disclose their hearing disability, but some people do not feel comfortable in doing this, as others may react in a manner that is inappropriate. Upon learning that someone has to lip read, some individuals remove their face mask, but this makes both the listener and speaker more prone to coronavirus, which is not ideal. You'd expect more transparent face masks to be sold for this reason. However, at the start of the pandemic, there were no transparent face masks FDA and CDC approved. This means that there were no masks regulated to ensure that there was significant protection against the coronavirus, whilst enabling those in the deaf and hard of hearing community to lip read. 6 months after the pandemic started in November 2020, there was only still one worldwide provider of a transparent face mask that was FDA and CDC approved. Whilst it is great that these masks are available, such a large demand on one single company does mean that it can be difficult for those who require a clear face mask to have access to one. Lip reading and face masks is also not the only problem that those in the deaf and hard of hearing community faced during the pandemic. As well as lip reading, 127,000 individuals in England use British Sign Language, BSL, as a means to follow a conversation. However, this creates additional barriers when other people around them do not know how to sign or communicate clearly. In the early stages of the pandemic, the UK government provided live daily briefings explaining the interventions that were being put in place. However, 6 months after these briefings started, there still was not a BSL interpreter available. Despite numerous campaigns to encourage an interpreter to be available, the government claimed that this could not be done safely. Northern Ireland, Wales and Scotland all found ways to ensure that an interpreter was available in their daily briefings in compliance with the 2010 Equality Act. However, those in England still did not have access to one and had to rely on charities to interpret the government's message rather than learning from the Prime Minister himself. Subtitles are available, but these are often not very accurate and are produced after delay. As you can see on the screen here, these are subtitles that are put in place after a recording is made. However, the following subtitles would be what is seen had this been a live recording. As you can see here, it is much more harder to follow my message, as the subtitles are produced at a different time to when I am speaking, and are not very accurate either. Video and telephone calls often don't include the option for subtitles to be reduced. Many GP surgeries and hospital clinics across the UK have adopted telephone or video calls as a way to ensure that people can be seen by their clinicians while socially distancing. However, over a third of hard of hearing individuals state that phone calls to healthcare providers prove difficult, and just under 1 in 5 struggle with video calls due to poor quality of audio. Such barriers to good communication with healthcare providers is concerning, and it can impact patients' understanding of their health condition and treatment, and therefore hamper trust with their doctor. As you can see, there are many additional barriers that those in the hard of hearing community face during a global pandemic. In future similar situations, we can only hope that these are addressed earlier, by including a BSL interpreter in live daily briefings, by ensuring that there is greater public access to clear, transparent face masks, and most importantly, ensuring better education in the communication difficulties faced by those in the deaf and hard of hearing community. It is important that we discuss the challenges that those face in other situations to ourselves, particularly those in hidden disabilities, so that we as a society can work together to make sure that these are addressed sooner. So speak up, both metaphorically and literally, to make sure no one is alone in a silent world. Thank you.